ಹದಿಹರೆಯದಿಂದ ಋತುಬಂಧದವರೆಗೆ ಮಹಿಳಾ ಆರೋಗ್ಯ ಸಬಲೀಕರಣ ಕಟಿಂಗ್ ಎಡ್ಜ್ 2025 ಸಮಾವೇಶ ವೀಲ್ ಆಫ್ ವೆಲ್ನೆಸ್ ಉಪಕ್ರಮಕ್ಕೆ ಚಾಲನೆ ಬೆಂಗಳೂರು. ಭಾರತದಲ್ಲಿ ಮಹಿಳೆಯರನ್ನು ಅನಾರೋಗ್ಯ ಸಮಸ್ಯೆಗಳು ಸದ್ದಿಲ್ಲದೆ ಕಾಡುತ್ತಿದ್ದು, ಇದರ ಪರಿಹಾರಕ್ಕೆ ತುರ್ತಾಗಿ ಸ್ಪಂದಿಸುವ ಅಗತ್ಯವಿದೆ. ಇಲ್ಲಿ ಪ್ರತಿ 10 ಜನರಲ್ಲಿ 6 ಮಂದಿಯನ್ನು ರಕ್ತಹೀನತೆ ಬಾಧಿಸುತ್ತಿದೆ. ಪ್ರತಿ 10ರಲ್ಲಿ 7 ಮಹಿಳೆಯರು ಸಕ್ಕರೆ ಕಾಯಿಲೆ ಅಥವಾ ಅಧಿಕ ರಕ್ತದೊತ್ತಡದ ಸಮಸ್ಯೆಯಿಂದ ಬಳಲುತ್ತಿದ್ದಾರೆ. ಸರಿಸುಮಾರು ಪ್ರತಿ 10 ಗರ್ಭಿಣಿಯರಲ್ಲಿ 4 ಅಧಿಕ ಅಪಾಯದ ಗರ್ಭಧಾರಣೆ ಎದುರಿಸುತ್ತಿದ್ದಾರೆ. ನಮ್ಮಲ್ಲಿ ಬಹಳಷ್ಟು ಜನರಿಗೆ ಆಸ್ಪತ್ರೆ ದರ್ಜೆಯ ಆರೋಗ್ಯ ಸೇವೆಗಳು ಲಭ್ಯವಾಗದ ಪರಿಸ್ಥಿತಿ ಇದೆ. ಇವು ಕೇವಲ ಅಂಕಿಅಂಶಗಳಲ್ಲ, ಬದಲಿಗೆ ತಕ್ಷಣದ ಕ್ರಮಕ್ಕಾಗಿ ಒತ್ತಾಯಿಸುವ ಎಚ್ಚರಿಕೆಯ ಕರೆಗಂಟೆಗಳಾಗಿವೆ.
That more specifically, the cutting edge conference that you're witnessing here is showcasing a lot of different trends in our own population. Implementation research is my very hardcore, passionate subject. So it is anonymized data, but we are seeing a lot of different trends in the Asian community, out of which the documented data is now emerging from pockets, very many pockets in India. Within our country, it's grossly different, unexpected, streams of data are rolling out. So we are very, very keen that we should demonstrate these trends to the governmental bodies so that some policies can be implemented towards that, where they have to invest. Health economics we have caught hold of. The idea of collaboration, sir, I sold 10 years back. I didn't realize that data was being sold. I didn't realize that how that data consistency and the security should be maintained. That is when mind started thinking of collaborating with professionals like the Doto Health and the Japaigos of the world, because they bring in totally the compliance angle on all these plug-in components. We as gynecologists or healthcare providers for women's healthcare know what we have to do and what is important for our country, because it's a lot being told by the Western world which we are not agreeing, because ours is a totally a different feasibility is also a problem, but the problems in itself is multiple. So we are very hooked on to basically tell the South Asian community of the health policy makers as well. That is what this data we are seriously hoping to be used for. If the trends are good, we are going the right way, then the investment also from the government is in the right direction is what we believe, and that has already happened in cases of anemia and contraception and some of the other things which we have rolled out in the last 2 decades. So that's like a small example of how we are trying to move the needle for diabetes in pregnancy, etc.
Of the data is of course the patients, because it is their own data, and there are of course a lot of discussions around how this data being utilized. So making sure we are compliant to every aspect of it is very important. And when I say the approvals and regulation and research are in place, it covers even the data angle. Now the CDSCO purview does not just cover the device, but how you are collecting data. When we have ISO 13485:2016, which is very specific quality management system aspect, which covers how we are communicating and storing the data. So there are guidelines to store the data locally, anonymize it, and also importantly the Privacy Act compliance of it also. So those are given aspect when we build the technology, and this has been a very clear guideline that is available, and we make sure we follow it.
ಪ್ರತಿಯೊಂದು ಹಂತದಲ್ಲೂ ಅವರಿಗೆ ಏನೇನು ತೊಂದರೆ ತೊಡಕು ಬರ್ಬೋದು, ಅದು ಬರದೇ ಇರೋ ಥರ ನಾವು ಮುಂಚೆನೇ ಎಚ್ಚರಗೊಂಡು ಅವರಿಗೆ ಜಾಗೃತಿ ಮೂಡಿಸಿ ನಾವು ಅವ್ರನ್ನ ಹೇಗೆ ಆರೋಗ್ಯದ ಗುಣಮಟ್ಟ ಕಾಪಾಡ್ಕೊಂಡಿರಬೇಕು ಅನ್ನೋದೇ ವೀಲ್ ಆಫ್ ವೆಲ್ನೆಸ್ದ ಉದ್ದೇಶ. ಇದು ನಾವು ಕಟಿಂಗ್ ಎಜ್ 2025 ಅಂತ ನಮ್ಮ ಕಾನ್ಫರೆನ್ಸಲ್ಲಿ ಯಾಕೆ ಲಾಂಚ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ ಅಂದರೆ, ಹೊಸ ಚಿಗುರು, ಹೊಸ ಐಡಿಯಾಸ್ ಎಲ್ಲ ಪ್ರತಿಯೊಂದು ಕಟಿಂಗ್ ಎಜ್ ಕಾನ್ಫರೆನ್ಸಲ್ಲೂ ಬರುತ್ತೆ. ಈ ಸರ್ತಿ ಕಟಿಂಗ್ ಎಜ್ ಅಂದರೆ ಫೆಮ್ಟೆಕ್, ಟೆಕ್ನಾಲಜಿ ಆ್ಯಂಡ್ ವಿಮೆನ್ಸ್ ಹೆಲ್ತ್ ಕೇರ್, ದಟ್ಸ್ ವಾಟ್ ವಿ ಆರ್ ಫೋಕಸಿಂಗ್ ಆನ್, ಬಿಕಾಸ್ technology is here to stay. Technology is giving us hopes that we will reach the last mile. ಎಲ್ಲೋ ಕೂತ್ಕೊಂಡು ಯಾರೋ ನಮ್ಮ ಹತ್ರ ಮಾತಾಡಿ ಸಲಹೆ ತಗೊಂಡು, if it's beneficial to that beneficiary, we are more than happy to scale this. ಮೊಟ್ಟ ಮೊದಲಿಗೆ throughout Karnataka, in many of the private centers, the wheel of wellness is going to roll and tackle every girl, every woman, everywhere, every time, to see various aspects of nutrition, mental health, menstrual health, high-risk pregnancies, infertility, contraception, menopausal care and cancer care. It is a complete life course vision from FIGO, which is our international organization, and I happen to be the division director of the FIGO Well Women Healthcare, and we truly hope that India will showcase this in action, just not the wheel hanging on the wall, but actually reaching the women themselves for the benefit of the entire nation. Women's health is nation's wealth. Namaskar.
HDR Healthcare Foundation, we are collaborating with JAPIGO to implement this wellness on wheels to take care of all the women at the community at large, from in all the age groups, starting from the menarche to the menopause. Whatever diseases they come across, it can be treated by using remote control devices. And we can, like a teleconsultation or telemedicine we can do. We can monitor the BP, sugar, other things, heavy hemoglobin of all the peripheral rural women. It is helpful both for the community and for the doctors also to reach the patients. And if the government collaborates with us and helps us to implement this throughout the country, it will be good for us. And through the media, you can. We request you to highlight this project, and so that more people will come in contact with us and to help us implement this project through HDR Healthcare Foundation. Thank you.